Thank you for tuning in, and be sure to comment and subscribe.
Hi everyone, welcome to my channel. This is Gina Chumesi, Psych APRN, coming to you again. So today we're going to highlight on SAD, or seasonal affective disorder. So I'm noticing that slowly the weather is starting to shift, and we're going to get to the point where it gets dark by 4 o'clock. So I just, thought of doing a video highlighting seasonal affective disorder, or SAD. Last year I did do one, so you can check that out, but this is like a shorter snippet version of that. So what we look for is a lot of people get a lot of energy in the sun, in the summer with the sun and everything. But as the season changes and we'll get into more, darker days earlier, so we have longer days and shorter nights. Some people start noticing lower energy levels, feeling more sad, more down. They lose interest in things that they will usually be interested in doing. They will have a lower amount of energy, lower motivation. Really difficult time getting out of bed, especially in the morning, for days. And I'm talking about this symptom not just one time, but like for days at a time. Changes in the appetite also is another one. Feeling like eating more sweets, or eating more in general, snacking more, gaining more, maybe weight. That can also add more to affecting self-esteem. Even things like difficulty concentrating, with that, longer days, maybe things like that can also start to affect concentration, affect mood, where, family members might notice people getting more irritable than usual, with simple things, feeling guilty about how they are feeling. And then the other thing also is we get more concerned when people start feeling like, having feelings of hopelessness, feeling helpless, or even thoughts to want to hurt themselves, or thoughts to want to hurt other people for days and weeks at a time, and they can't seem to get out of it. So when you notice, the first few and the last 2 or 3 that I mentioned, please call for help. You can call 211, get somebody on the phone with you, or, reach out, talk to your therapist, find a therapist, call me, go on Psychology Today. There's so many therapists on there, psychiatrists, psychologists that you can connect with. And if it's even just through the season, that's okay. Knowing that those feelings are valid and it's okay, and you're not alone, and knowing that other people do feel like that. There are people who feel like that, but they do other things like maybe working out. Even myself, there are times where I can't feel like that towards the fall and winter times, but I find that walking, exercising, doing yoga, meditating, praying, helping be more positive and more energetic, going on hikes, being outside a lot is my thing. So if that's your thing, hey, good. If not, there are medications that can help you. If you connect with a psychiatrist, we can prescribe you something, even if it's just short term, for 3 to 6 months, to kind of aid you in the process through those days. Why do you have to go through it alone? Why do you have to go through it painfully? If there's something that can help you bring a little bit of those good chemicals like serotonin, dopamine up in your brain, and make those months a little easier for you to tolerate. So this is my little snippet. Look out for my next video on insomnia, and how worldwide sleep deprivation has become such a big issue.
Thank you for tuning in, and be sure to comment and subscribe.